Have you ever wondered what happens when psychedelics, specifically MDMA or the substance often associated with rave culture, meets couples therapy? Today, we're going to find out. I'm speaking with a leading expert who conducted the very first clinical trial of MDMA-assisted couples therapy, exploring its potential as a tool for relational healing in the context of trauma. Welcome back to the integration session. I'm Dr. Elena Koning, and I'm so excited to bring you this conversation about a topic that's been making waves in both the scientific community and the media. My guest today is Dr. Anne Wagner, a clinical psychologist, researcher, and founder of Remedy Institute in Toronto. Her groundbreaking work focuses on the use of MDMA to enhance evidence-based psychotherapy, particularly for individuals and couples navigating the challenges of PTSD. In this episode, we'll cover what MDMA actually is, how it affects the brain and body, and why it just might be a powerful ally in helping couples heal together. Let's dive in. Hello, Dr. Anne Wagner, and welcome to the Integration Session podcast. You've been on my mind as someone that I've been wanting to interview since before this podcast was even a thing, so I'm very excited to chat with you today. Thank you so much for being here.
Thanks so much for having me.
Of course. Could we start by just diving into a little bit about yourself? So if you don't mind just telling our listeners a bit about who you are and how you became interested in the clinical utility of MDMA.
Sure. I'm Anne. I'm a clinical psychologist, and I run a clinic called Remedy and a research institution, which is a charity called Remedy Institute. Let's see, how did I become interested in this? I have always been really interested in how people interact with each other and relationships and what makes us tick and what makes us feel connected or feel disconnected. How do we understand how our relationships are working in our world, and how do they help bring us joy, and sometimes how do they bring us pain? So that's, I think, been a question throughout that's been very interesting for me. And I knew pretty early on that I was curious about psychology. Actually started off thinking I was going to go into theater, and that was, in its own way, psychology, right? Like you're understanding a character, you're understanding how people express themselves and emote. And it felt like the part of an even deeper study of that was psychology. So I remember making that decision in undergrad and kind of following that path pretty intensely into getting into grad school. And when I got to grad school, I was studying what seems really disparate at this point, but it's not. It's all interconnected. I was really interested in the experiences of people living with HIV. And so that felt important to study. It felt important to help in terms of especially the concept around stigma. And as the more I learned about stigma, the more I understood how that intersected with trauma. And so the other part of my clinical interests have always been around trauma. And so understanding how those things all intersected together kind of led me further and further into work focusing on trauma, focusing on post-traumatic stress disorder, but always from a relational lens. So thinking about how does this impact relationships and different people. So that brought me into working with my postdoc mentor, who's Candace Monson. I'd worked on a trial of hers in grad school, and then we started doing work together when I was a postdoc. And we were approached about potentially collaborating on a study with MDMA. So she had developed a couples treatment for PTSD, which is really cool. It's for both people are equally involved in the treatment. When we say couples, it was originally developed for romantic couples, but it's actually been tested with lots of different people in all kinds of different relationships, which I like. So, because sometimes, it's not always the romantic relationships in your life that are the ones that you need to heal within. But we were studying that treatment, and then, we started to look at it, including MDMA. And so together with two colleagues, Annie and Michael Mithofer, who are some of the kind of pioneers in this newer wave of MDMA research, the four of us were the investigators on this first trial that we started developing in 2013, 2014, using this combination of a couples treatment for PTSD plus MDMA. And so at that point, I was just really fascinated by this possibility, and this possibility, particularly for MDMA, to help that relational piece, for helping people really connect in to themselves and to each other, and to help us develop these strong and brave relationships to ourselves and what's happened to us and what we've lived and survived, and also how we are with other people. So that's been my trajectory in. And then at that point, I was just really interested and fascinated. So it's really driven where the questions and the curiosity I have intellectually are. And so I've then started Remedy to be able to continue doing that research and doing that work. And so we've been running studies out of Remedy as well.
Very cool. Yeah, that's an awesome story, and it's really like a multidisciplinary journey that you've been on all the way from theater class. So that's really interesting.
Yeah.
Um, yeah, and we'll definitely get into like your work with couples therapy, how that is working, what are like the mechanisms and everything. But I want to start with a little bit more of like a basic introduction to MDMA for our listeners that maybe don't exactly know what it is. Some may think that, oh, they hear MDMA and they think, oh, like that's like the party drug ecstasy. So what would you say to someone who doesn't know anything about the substance?
Yeah, so it is a chemical substance that is created, and it has had a very popular run in lots of different settings, including in sometimes it's known as the name ecstasy or Molly, oftentimes in you know settings that are not research or not clinical. It's we actually don't know what's in it, right? So someone might be thinking they're taking MDMA, but it's in fact they're taking something that's a combination of different things, or might not be MDMA at all. But MDMA is a molecule that creates a reaction in the brain and in the system that creates a huge, I would say, dump for better terms. Like it happens, there's a lot of release of serotonin, dopamine, norepinephrine, as well as a whole host of other neurochemicals and hormones that are there. So that big release of neurochemicals creates the emotional environment for people to be able to be with their emotions in a different way and be with their memories and experiences in a different way. A very, very simplistic description. I'm not a neuroscientist, but I'll try to do this in for the general audience. That what happens in the brain too is there's different areas of the brain that become more activated or quieter when you're taking MDMA. So, for example, your amygdala, which is an area of your brain that's very closely related to the fight, flight, freeze, fawn response, that gets quieter when you take MDMA. And then your prefrontal cortex, the area of your brain that specializes in thinking and putting connections together and planning, that part of your brain becomes more active. And that's a really beautiful thing, especially for folks when they've experienced a trauma or they're having difficulty in interactions, because typically what happens is your amygdala is more activated and your prefrontal cortex is less activated. And so if you have the assistance of MDMA, it helps balance that. And so that the thing that's overly activated becomes more easily worked with, more regulated throughout that. So in some ways, it's adding regulation to a system that allows you to be with things and look at them in a different way, which is incredibly helpful.
Yeah, it sounds like it. Especially for a condition like PTSD, it sounds like a great sort of array of neurobiological effects that can help in therapy, which is really interesting. So I'd love to
Mm-hmm.
dig a bit more into those sort of psychological mechanisms that might be coming out of those brain changes that MDMA is causing. So you have those physical changes, but what does that feel like to a person that is having an MDMA experience?
Mm-hmm. So there's lots of different ways that it can feel. So I think that's an important thing to remember too, is that even though it has this name, recreationally as ecstasy, it is not often an ecstatic experience. Sometimes there can be ease or joy that can be there, but it's not naturally going to move you necessarily towards ecstasy. Instead, what can happen is that there can be, especially at the beginning of the experience, there can be a real activation. So people can feel really quite anxious, and especially if there's trauma involved. And so we're helping them therapeutically with that in the trials. But then as it takes its full effect, people can feel well, what's interesting is they can feel all of their emotions, right? So it's less that they're feeling more or less of something. It's more that they can feel everything and that they can stay in everything. So oftentimes when we're really upset or we're scared about something or um, there's something else activated, then we move away from it. We're not able to stay present, and that can come in different forms of dissociation or distraction or avoidance. A lot of it subconscious, but what the MDMA helps you to do is stay with what's there. And so when it's talked about like it helps you actually look inside to see what's present, it's because you're able to tolerate it. You're able to stay with what's present. And so what that can feel like, it can feel like you're able to actually stay long enough that you can have empathy for yourself and you can feel compassion. And you can also feel that for, if it's the kind of correct feeling, meaning like if you're being blocked from feeling empathy from somebody else that you want to be feeling empathy for, that can help with that. It can also help you feel more connected. It can make you, especially when people have been blunted or they're feeling disconnected, it can help you kind of re-access those feelings that might be missing. And it can help you also look at things in more detail. And so we often find that people will be familiar with the memory, the experiences that they're experiencing when they've taken MDMA. In fact, they're usually very familiar with them, but it allows you to look at it in all its detail, right? It allows you to see context and nuance as opposed to having it be too overwhelming so that you can't look at it. Instead, you can stay with it. So that's when we think about both treating PTSD and working with couples, those are really important benefits that it could offer.
Yeah. And it also sounds like a lot to be suddenly able to access all of these emotions and have those all sort of come up for you. So, are there adverse events, and what does that look like usually?
Yeah, I would say it's not necessarily as intense as that might sound. It's more that something might be there and then you're able to be with it a bit more. So it's not usually particularly a flood of things. Rather, it could be memories coming in, but you're able to see them. And I've had people describe it as kind of the memories are going in order, right? They're like, oh, they're being organized. And sometimes there's um, a big or difficult emotion that's there. And then that's why we're there therapeutically, to help in those moments, is to help them navigate through that, talk through that, process it when it's there. So, I mean, there are adverse events when it comes to MDMA. There's lots of side effects to it, but they're typically quite mild and they're typically pretty short in duration. But people will get lots of physiological changes, meaning they might get hot or they might get cold or sweaty, heart palpitations. It does increase your blood pressure, it increases your heart rate. So, those are all things we're very careful about in medical screening to make sure that that's going to be safe for people to have that elevation. Some people can feel a little bit nauseous. We're prepared for all of those things and we help people navigate through them. And sometimes it will cause, or well, not cause, but it will open up these emotions that people have not been able to feel before. And so that's important afterwards, that they have therapeutic support if they're doing it in a kind of clinical setting to be able to navigate through it, because it could be destabilizing in some way if you didn't have the right support around you. And so that's typically, we're really oriented to that, to providing support and support for the relationship, afterwards. And so, because it can often feel, you can feel a little bit vulnerable and raw afterwards. And so it's important that that's navigated through really skillfully.
Definitely. And I'm really interested in what you've been talking about with regard to like relational healing with psychedelics, because I
Mhm.
find a lot of the psychedelic literature is using psychedelics for one individual.
Hmm.
There's very few studies that test it in like a group scenario, which is interesting, especially considering the sort of ancient and indigenous context where it's used often in like group ceremonies or group healing contexts. So I think that's a really interesting direction.
Hmm.
I want to dig a little bit more into specifically for PTSD. Why is couples therapy? Because I know there's other forms of therapy for PTSD as well. So,
Hmm.
what is unique about like the couples therapy aspect of PTSD? Why is that so important?
Mm.
And why can relationships in that context help with PTSD?
Yeah. Well, I think one of the most important things to think about with trauma is it can feel very isolating, the experience, but we are social creatures. We are always in relationship, whether they're helpful, painful, present, absent. They're always the the specter of relationship is always in our life. And then also we exist in communities of people. So that means that what's affecting us will and be affecting other people as well, as much as we think that maybe it isn't. So if you think about when folks are having trauma symptoms, especially trauma symptoms that really impact relationships, include feeling disconnected and dissociated from other people, feeling emotionally numb, being really having a strong hyperarousal or reactivity to things. All of those really impact your relationships, amongst other pieces of trauma symptoms as well. But those ones are pretty huge. And a lot of the times the people around them are impacted by that, and then they're in effect helping to create together a system that's going to make things okay. But if we're making things okay when all the symptoms of trauma are still present, it means that in some ways we're keeping them alive, and so we're keeping them reinforced. So when we're able to treat something with two people together, it means that we're not only getting healing for the person who's experienced the trauma, we're also getting healing for the other person, the partner, who may have, maybe kind of unaware or maybe very aware of the impact it's had on them, but also on the functioning of the system, of the relationship, and to try to create or help facilitate some peace and some joy and some connection within that too. So I like to think of it as you're doing this intervention for multiple layers of people and relationship. And then that, when two people are brought along together, they're also able to bring that out into larger systems more readily than just one person is. Like they can bring it out to the rest of the family or to community or beyond there. And therefore, you're getting a wider spread of healing and also of understanding. The other thing with trauma is that oftentimes when people have PTSD or complex PTSD, it's because there's been an element of it that's interpersonal. And so it could be that the trauma itself is interpersonal, or the reactions and the situations afterwards are inherently interpersonal, and people may feel disconnected, or they may feel unsupported, or they may have had people saying things that were well meaning, but in fact were reinforcing of something difficult or not supportive. So no matter what, there's going to be something interpersonal that's happening within it. And so to be able to actually experience healing with another person can be extremely helpful in recognizing that connection is safe and okay. It can feel good. It can feel supportive, and you can work through that. And so that's important because it doesn't have to be, the person with which the trauma occurred. It can be somebody else who can be that safe person. And it's not just the therapist, right? A lot of the time people talk about that relationship with your therapist as being the thing that's connecting and doing relational psychotherapy within that, which is also great. But your relationship with the therapist is within the bounds of therapy. And that's inherently, there's a power differential, there's a dynamic there, and it's the client is not learning about the therapist. So it's not bidirectional in a broader, like really intimate sense. Rather, if you have two people who are going through that process together, then it's more reflective of what relationships are going to be like beyond there too.
Yeah, that's so interesting, especially because, like you mentioned, like the therapeutic relationship is very important, but also just like people in everyday life, like you trust the people that are closest to you. So if that person is there during that, maybe they can help you integrate your learnings and healing throughout everyday life. So that's really
Yeah.
interesting.
Yeah. And they can see the change as it's happening and they can experience it too. So it's not this, things don't get lost in translation along the way of, I've had this big breakthrough in therapy and now I have to go tell my partner about it, but how do I explain that? But rather like, oh no, they've been there. They were in it. They witnessed it and experienced it and they were able to see all those pieces alongside, which can be very powerful.
Yeah, it makes me wonder if that should be sort of a model to consider in other types of psychiatric illnesses. Like, obviously, there's like
Yeah.
family based therapies in some contexts, but it sounds very, very important.
Yeah, there some exist, like this concept of you can you can have different directions of focus in couples therapy. It could be the relationship, it could be a treatment for one person's presenting concern. So there are different ways of doing it. I think it's just it hasn't reached its full dissemination yet around people knowing. So it's good to spread awareness about it.
Yeah, definitely. And I'd love to talk a bit more about a study that you worked on and sort of going into the research on MDMA and couples therapy.
Mhm.
You played a huge role in a very important study in this space. So, from my understanding, it was the first trial of MDMA in couples therapy that involves PTSD.
Mhm.
So, what did that trial design kind of look like, and what thought went into that? And also, what were the main like outcomes that you were looking at? Like, were you interested in the safety of it? Were you interested in how well it was helping people with their symptoms? What were you looking at there?
Yeah. So the model for that study, so it was a pilot study. So that means it was very small. We had six couples go through that study, and it was really meant to be testing the signal to see was this going to be uh, an effective, feasible, safe combination of things to put together. And so that we looked both at safety outcomes but also at like what happened with PTSD and what happened with relationship satisfaction. Those were the kind of the main outcomes. And the design of it was combining cognitive behavioral conjoint therapy, which is this couples treatment for PTSD, with two MDMA sessions. And we specifically chose the timing of those MDMA sessions to catalyze the treatment. We wanted them to be at places where we felt like it could really help to deepen or strengthen some of the components of the therapy that were happening. And so the first one happens very early on in the treatment. And so at the beginning, people are taught about some different communication skills and are helped to communicate together, have conflict in a healthy and productive way, to kind of get at any difficult or unhelpful behaviors that are there and understand how trauma is living in their relationship. So that meaning that it's understanding the symptoms that are there, but also the dynamics that are happening around it. So you start with that, and then you prepare for the MDMA session by talking about intentions and the logistics of it, what it's going to look like to work with it. And then you have the MDMA session to really deepen in. And then following that, you integrate and then you move back into CBCT. And at that point, you're moving through trying to both improve the relationship or like foster the good that's there and start to do some behavioral approach. So starting to help people move towards things as individuals, as in a couple that they might have been avoiding. And then you start to move into meaning making. And that's kind of the crux of the, or this second half of therapy is really focused on how do you understand what's happened, what stories do you have about it, what narratives do you have about it, and where is some of that stuck? And what are some of the things that have happened that are keeping it stuck? And so we move through different themes that are related to trauma that are very common, and we investigate and we take a look to see what's present. And there's another MDMA session right in the heart of that trauma processing part. So yeah, that combination worked really well in the pilot. So we had really strong effect sizes in terms of reduction of PTSD symptoms, as well as improvement in relationship satisfaction. And so, it was interesting. We looked at PTSD symptoms from 3 different lenses. So one was an independent rater, so someone objectively, but a researcher looking at it. And then it was also from the report of the person living with PTSD and their partner reporting on what they're seeing in terms of the symptoms. And so that, to me, I love those 3 angles coming together to create a bigger picture about what does it look like. And we found that, all 3 of those things were in line with each other and improved in tandem. And yeah, and those results held out until the 6-month follow-up at that point. And so now we're running a large trial currently that is a replication of that, but the bigger sample. And so now we're assessing that same combination, CBCT plus MDMA versus CBCT on its own. So what does it look like what is the addition of the MDMA to it? And the group that just gets CBCT, once they finish treatment and they do a 3-month follow-up, they can then what we call crossover into a condition where they get 2 MDMA sessions within more general couples therapy that doesn't have a trauma focus.
Interesting. That's an interesting design.
Mm-hmm.
Yeah, so very promising early evidence, and now you're sort of seeing if that holds up in a bigger sample and compared to like a control where they're not getting the MDMA right away. Um,
Exactly.
Interesting. And have you started collecting data? Any insights on how that's going so far?
Yeah, what we've had, we've been recruiting, and we've got 4 dyads enrolled already, which is great, and another bunch in screening. But we're still in process, so it's really nice to be still recruiting and screening for folks. But yeah, so early impressions are that it continues to work, which is great. And I can't say much more than that at this point, but clinically, it's looking good. Yeah.
Cool. That's awesome. Good to hear.
Mm-hmm.
And based on your experience, or if you have any specific anecdotes from like couples that you've seen go through, what elements of the MDMA therapy do you think really contribute to the positive outcomes? If you could like identify like certain things.
Yeah, I think one of the most important things that I see, um, I think for couples in particular, is the reduction in fear in terms of saying the things that they are hesitant to say to each other. And that's just so important, right? Like either bite our tongues a lot, or we don't say things, or we explode at each other. And so it's the ability to actually say the things we need to say and be honest and clear, and doing it in a loving way. And I think that is an incredible gift, and it really shows the couple that they can do it, that have that innately in them. That is not a product of the medicine. It's just the medicine helps kind of create the conditions where it feels easier to do that. And so they can take that forward with them. I think that's really important. And I think also it's really, really helpful to have the person who's having the trauma memories or experiences be able to go into those, and then the partner be able to witness that it's okay, that they're able to do that, and that it's safe, and that the memory is not going to harm them. It may be having difficulty. It's not going to harm either the person with PTSD or the partner, because I think that can be a real challenge. Is sometimes the partners are very like, ooh, I don't want to hear about it because I'm scared it's going to hurt me or cause more damage to you. And then the person with PTSD is also usually very protective about their experience. They don't want to harm somebody else. So that's helpful to be able to have it be that it feels more, they feel more able to be with the emotions that are there and be with them together and witness each other.
Yeah. And that sort of makes me think about this broader question in like the psychedelic literature as to like which aspects of the psychedelic therapy are contributing to the positive outcomes, like how much of that contribution is the substance itself and the changes that it's causing in the brain, and how much is the psychotherapy part. So what are
Mhm.
your sort of, I know it's not like a clear answer yet, but what are your sort of opinions on that?
I mean, as a psychotherapy trialist predominantly who just happens to be adding MDMA to the interventions, I certainly have the perspective of like, I really think it's the therapeutic process that's helping. I think the MDMA kind of can help that process along and can catalyze or whatnot. I mean, this is a study to be done. I don't know ethically, legally, what it would look, how we would feel clinically about this, but doing a study where there's no therapy and MDMA is being given, I have no idea. Like, it could be fine. It could be helpful, but I've certainly seen the benefit of the therapy getting catalyzed by the MDMA. And so, certainly my bias at the moment is that I think that it's the therapy that's the really helpful part. But I'm happy to have my mind opened with that too.
Yeah, no, I definitely agree. And I think the psychedelic literature is kind of pointing in that direction. And
Hmm.
as we look towards sort of like the implementation of these tools clinically, it's sort of promising to see the psychedelic as like an enhancer of this psychotherapy that we already know is effective and evidence based, and it's sort of just helping people have like a boost to get through it and to have positive outcomes. So, yeah, I think I
Yeah.
agree with you there.
Hmm.
Um, so, what are you working on now, and what are you working on next with the Remedy Center?
Hmm. Yeah. So as I mentioned, we're in the midst of a trial right now. So that's um, exciting, and we're open for recruitment. So if people live in the Greater Toronto area, they can come check out our website and see if that would fit for their needs. And so there's that trial that is currently running. We also recently finished another trial that we're currently doing our data analysis for. And that was a trial that was combining cognitive processing therapies and individual treatment for PTSD with MDMA. And so that one is all done, and we're in the process of kind of looking at the results, and which also it did have good results. We have their preliminary analyses, but we're going to be getting that one ready for publication. And yeah, and then so that's our kind of main research focus going forward. And yeah, we're excited to see where that kind of couples angle. I mean, that's really where my passion is around the relational piece and the where this can go. So we've got kind of all hands on deck getting that study across the finish line.
Very cool. Well, best of luck with all of that. I'm excited to
Thank you.
see those results come out.
Thank you. Me too. Yeah.
So, final question, a little bit of a fun one. I kind of like to ask the psychedelic experts. Obviously, integration is the name of the podcast, and it's an important
Mhm.
piece in psychotherapy and psychedelic therapy. So, sort of taking what we've talked about and MDMA and couples therapy, what is a lesson that you've learned while studying MDMA that you think the general population can sort of take into their own lives, or that could maybe help broader audiences?
Mm. Definitely the most potent thing for me is that we can be brave in our relationships and that we'll be okay. And that not only okay, it will help us. It will help us individually, it'll help us together. And that being brave means being heartfelt and heart led and open and vulnerable and clear and kind. And so I think that is something that becomes very clear and amplified with MDMA, but is a universal. And I know that that's there regardless. And that's the thing that I think is the big takeaway that's important.
I really love that message. Thank you.
Thanks.
Awesome. Well, this was a pleasure. Thanks so much for joining me.
My pleasure. Thanks for having me.
Of course. Thank you so much for listening to this fascinating conversation about MDMA therapy with Dr. Anne Wagner. I'd like to thank the Center for Psychedelics Health and Research at Queen's University and the support of our sponsors at the Ontario Brain Institute, the Canadian Biomarker Integration Network in Depression, and Providence Care Hospital. Until next time, be well and integrate wisely.